Bob, how do you make it out in the schools?
We lost him. I'm not sure you heard your question.
Hi, Bob.
I heard the question. Yeah, overall things are going well. Considering we continue to kind of I look at the data still every day, sort of just get an idea in our community and zip code, sort of the number of cases that we have, and the cases reflect in the schools as well. Luckily, we have more vaccinated than others in the area. I know that our vaccination rates, even for our students at the secondary level, are higher than other school districts in the state. So that's good to see, and that definitely has had an impact. I know that when we do have a case, there's a lot of contact tracing going on, and almost every single time that occurs, there are students that do not have to quarantine because they've been vaccinated, which is really good to hear. And our number of staff cases and vaccination, staff cases and quarantines are extremely low. Very, very few at all. Good to hear. So overall, we're plugging away. We're trying to kind of do as much as we can to make school as normal as possible. But in every case, we have twice as many kids or more in the school every day than we did last year. And that definitely has increased quarantines a little bit because people are closer to one another, especially during lunch times. We try to separate as much as possible and those kind of things. We are going to be having our homecoming activities, and obviously the game will be outside, parade will be outside. We're actually doing our dance outside as well, so we can kind of just try to stay from having students inside and wearing masks. And our dance this year actually is going to be kind of a cool venue. We're going to have it at the Love Creek Elementary School, playground area. Behind each of the new elementary schools, there's a synthetic surface, grass, and it's enclosed on three sides with the school, and then there's a fence on the back of the playground. So that's where the homecoming dance is going to be this year for our high school students at one of the elementary schools. It's a beautiful setting outside. So I'd be glad to answer any questions, but overall things are going well. I think what makes it go well, I guess, is the fact that we've been through this before, and sort of everyone's a little less apprehensive about where we are, and obviously we have a lot more people vaccinated than we did most of last year, so that makes a big difference too.
How are you determining your vaccination rates? Only through contact tracing, or do you have a sense for who's vaccinated before?
We have a sense. We haven't done, we haven't asked every individual employee, but every time we contact trace, the majority of staff are excluded from, in most cases, any kind of quarantine.
Have you been
I know the state is having conversations about where does this go in the future with vaccinations, and kind of like some other states, mandatory vaccinations and/or testing, those kind of things. But that decision hasn't been made yet by the state. But I know that it is being discussed about being a possibility of having some type of weekly testing if you're not vaccinated as a mandatory, I guess, situation for educators, which means not just teachers but paraeducators, cafeteria workers, everybody.
Sure.
We are trying to get more people into our schools to help our students. We have a lot of mentors in our communities. We have parents that want to be involved on field trips. We have volunteers, and we're kind of rolling that out slowly this year, but as we do, vaccinations will be a requirement for anyone who is mentoring students in our schools or attending field trips with their children and those types of things.
Good. You were speaking about mandatory testing versus vaccination. The city implemented that policy,
Right.
I guess, in early...
Actually, last week. And Shelby, could you tell us, have we had any pickup in vaccination rates, or do we know? Or
No, unfortunately. Well, we have had a couple.
can you come up to the mic just so everybody can, everybody can hear you?
Hello.
Thank you.
Yes, we have had a couple employees who have gotten their first vaccine, so we're waiting on the second. That's only been one or two, but it's better than none. So.
And you're getting your proof of negative tests,
Yes,
correct?
we've gotten all the vaccination cards for those we've asked, and we've been getting the weekly testing from those who are unvaccinated.
What day of the week are they getting tested? How do you manage that?
We've allowed them to do it Monday through Sunday
Uh-huh.
because of the different schedules with the police department. So as long as they provide us the test Monday through Friday, then we ask them to take a picture or send that their scheduling confirmation so that we have proof of that, and then we just wait for the results and track it that way.
Good. That's wonderful. Thank you very much for your follow-up on that. I noticed that Christiana terminated 150 people who were unvaccinated, according to this morning's paper.
It did, yeah. So they announced before the governor announced his program that they were going to have a end of September deadline for people that were unvaccinated. So, kudos to them, I guess. It's tough, healthcare is like everywhere else where we're struggling for employees right now.
Right.
So it's difficult to see, they said there was like 90 full-time equivalents, but it's difficult to see those 150 people leave. But the state has a program that starts on Thursday that mandates that all of the healthcare facilities track whether their employees are either vaccinated or weekly tested. So the rest of us are headed there at the end of this week.
So is BB going to adopt that policy, I would imagine?
Well,
Or have you already done that?
well, we're adopting a policy where we're either going to vaccinate or test,
Okay.
not vaccinate or terminate.
Okay.
So we're a little different in that respect.
It's still a good policy.
It is.
So your policy will be very similar to what we're doing at the city level?
Yeah, it's almost identical.
Right. Thank you.
So, yep. Do we have anything else?
Well, I think in terms of, downtown, we're seeing a real mix of what people are wearing, masks or not wearing masks. We've heard from some shopkeepers that, their employees are still preferring. We still have some shopkeepers that are having a sign on their door. But I think generally speaking, people are looking at an honor system. Restaurants, I think the restaurants I've been in and what I've heard from others seems to confirm that employees in restaurants are wearing masks as they're servicing tables. So I think from that standpoint, people are being cautious. Outdoors, I think we're seeing, there's no effort to mask for the most part. Occasionally downtown, I think, but the overall, there was a concert in the park on Sunday night. I think everybody there was unmasked, which is fine outdoors, I think. I know that in some of the major metropolitan areas, they're asking for proof with a CDC card or proof of a negative vaccination. I haven't seen that being asked in a restaurant here yet. But I'd open it up to anybody else. What are you seeing? Is there anything different than what I'm reporting? Okay. So the question that I posed to you yesterday is, last year we postponed trick or treat, and obviously trick or treat's a big thing here, and just like Santa's house was when the bank closed, was closing, and so I think given where we are, and the fact that we're still having some issue, there's going to be a question about, is it safe to trick or treat? Do you have a feeling on that?
Sure. So everything that I've presented so far are hard facts. Right. So what I'll give you now is purely my opinion.
Okay.
But I think it makes sense to encourage trick-or-treating. And the reason why I say that is the activity itself is all outside, right. Which we know is a very safe activity. Everything outside is safe. We also know that you typically don't get this virus from touching a surface like many other viral illnesses. So it's all respiratory. And my other thought with it is that if you discourage trick-or-treating, that would encourage people to have trick-or-treating parties. Mm-hmm. And those would be inside. So you'd have more people inside somewhere where there's a little bit greater risk. So I think it kind of makes sense.
Right. Okay, good. I think that will be a big plus for people, because I know people are trying to resume activities, normal activities. We certainly, Bob has indicated that at the school, and I think there are certain corridors, particularly Kings Highway, Savannah Road, in the close downtown area where the houses are closed, that trick-or-treating is a big deal. And so I would like to feel that we can recommend that we go ahead with that, and I appreciate your comments.
Yeah, I think and actually, having Bob on the call is a good point. He's demonstrated that you can cohort kids successfully and not create a super spreader event. And certainly, they're in much more closer contact in a cafeteria than they are trick-or-treating.
Yep.
So I guess the next question will be maybe next month is the Christmas parade. That's coming.
Yeah, and again, it's an outdoor event, unless there's some major, these are kind of month-by-month things, but we need to make a call on that pretty quickly, so.
I think most of the epidemiologists that have been reporting on this fourth wave are suggesting that the percent positive cases will slowly dwindle as we get towards the end of the year.
Right.
I think if we stay on the same trajectory, we should be even more comfortable with the Christmas parade than we are with Halloween. So, but we still have some time, although the planning people really need to know that relatively soon, I guess.
Right. Yeah, actually, I'm sure that Betsy's not on the call this morning from the chamber, but she's already getting people who want to put floats in the parade or marching units or whatever. So, I'm sure she'll be interested in hearing that. And so, I think as much of normal activity, as long as it's outdoors, is something that we want to try to encourage. I think the house tour for the Historic Society is still going to be virtual this year, but other activities. I noticed the Children's Beach House had their beach barbecue, which was another outdoor event. So I think people are very consistent with what you're saying. I also note that Delaware is moving ahead with the booster shots, and I actually have gotten mine. I fit into that older category. So, I think that the local pharmacies seem to be getting at least the Pfizer portion, which of course Moderna and J&J are not yet approved. And so I assume that people are beginning to do that if they're 6 months out at least.
Yeah, speaking of the vaccines, Pfizer is hoping to get approval for 5 to 11.
Right.
Hopefully within the next few weeks, and Moderna is close to getting approval for third shot. So, and it's also flu season. So we're getting into flu season.
Right.
The hospital has started their very active. We try to vaccinate everybody within 48 hours in a big blitz. We don't get everybody, but we get the vast majority of people.
Well, last year you did a fabulous job of getting offering, 48 vaccination clinics over a period of time, a month or so, and it was great. And I think nationwide there was a downturn in flu overall last year, largely because we weren't gathering, we're getting close to one another, but also I think a better pickup on the flu vaccine. There's been a mixed message sent out by the public, by various people about how much space should be allowed between a COVID shot and a vaccine. Do you want to offer any opinion on that?
Sure. I think that at this point, most people that are getting COVID vaccine are getting their third dose. So they kind of know how they responded to the second dose. Some people had no symptoms at all, and some people had more symptoms. My recommendation at this point, flu gets to be really prevalent through the holidays and into January. If you look at the flu activity on the CDC website, right now it's very sporadic, and then once people begin to congregate for the holidays, it becomes much more endemic. So we have some period of time, we're 6 weeks from Thanksgiving now. So I would choose to get either one now, and then I would see how you feel. If you have no symptoms, then there's no reason not to get the second vaccine really within a couple days. If you feel at all a little under the weather with the first vaccine, just wait until you're completely recovered. But there appears to be no danger to get them very close together, as actually Moderna is offering in the future both a coronavirus and an influenza combined, a single shot. So the interesting thing is last year, we saw very little influenza in the country. And you can guess all the reasons why, one of which was we were still all largely masked and we weren't congregating. So it'll be interesting if the vaccine for this year, how effective it is. The way the vaccines are developed for influenza is, influenza sort of travels the world. So as influenza is endemic in the southern hemisphere in the summer, the pharmaceutical companies are studying that, kind of guessing how it will mutate before it gets to the northern hemisphere in the winter. Well, we didn't really have that rotation for a year, so we know influenza is still there, but I'm not sure how confident they are that they exactly know what it'll look like. I have faith that they will get it correctly, but this will be the first time in a long time where they won't have last seasons of data to really go after. We had some flu last year, but not nearly what we would normally have.
Okay, well, we certainly thank BB for all the efforts you're doing to make sure that everybody who's willing and able to get the vaccine and the flu shot will get both, and encourage everyone in the community to do that. I know the vast majority of people I interact with have gotten certainly their COVID shots at this point. So thank you again for the efforts of the hospital to do that.
Yeah, absolutely.
I see Anne Marie, you've joined us. You have any questions at this point?
No, I don't have any questions. I've just been listening to the conversation.
Okay, great. Good. Okay.
I have a question.
Yes.
Dr. Cowan, originally they had said 8 weeks after your second shot. 8 months after your second shot, and now they're saying 6 months after. Do you have an opinion on that?
I think 6 months is fine. The distance between your second shot and third shot, the initial concern was that you would have a drop in antibodies, which is why they pushed it from 8 months to 6 months. It had nothing to do with the safety profile of the vaccine. So I think it's fine at 6 months. For me, it will be 8 months just because I had my vaccine in the beginning of January, first week of January. So when I get my third shot, which will be any day now, it'll actually be a little bit longer than that. But I think it's certainly safe at 6 months. It's actually, you actually have a good point, the more I reflect on that. For people, as you age, your antibody response decreases. So the older you are, the more likely it makes sense to get it closer to 6 months as opposed to a very young person who probably will keep that antibody response for a few more months. But there are...
That answers our question.
And then the question going forward for future vaccines will be if we'll need boosters based on changes in the virus going forward, or whether we'll have enough antibodies to treat any of the variations. So time will tell that. Okay.
Dr. Marble, you have anything?
Yes. Dr. Cowan, I have one question. This is Patty.
Hi, Patty.
Okay, so first responders receive Moderna, and we are approaching our 8th month. Someone suggested that it's safe to mix Pfizer and Moderna, but I don't believe that's correct. Can you talk about that?
So the CDC's initial recommendation was, and this was regards to your first and second vaccine, that they recommended that you stay with the same manufacturer. However, if you weren't able to obtain a second dose with the original manufacturer, it was safe to get the other mRNA. So essentially, you could interchange Pfizer and Moderna. So I do think Moderna is going to be approved relatively soon within the next month. So you could either choose to wait or you could choose to get the Pfizer. I don't think it's particularly harmful for you to get the other vaccine.
Thank you.
Yeah, you're welcome.
I noticed that, particularly in New York State, there's now an app that people are putting on their phone that they can load their CDC card on. Is there any talk at the state level that you've heard of about the state creating an app for people to do that?
I haven't heard talk at the state level. I have heard a lot of talk about the vaccination cards being forged.
Oh, of course, yeah, we've heard that too,
So
yeah.
the fact that you have a card doesn't really mean a whole lot.
Right.
And the thought is that these apps would actually get their data not from your vaccination card, but from the Delvax database.
Right.
But I have not heard the state itself looking to develop an app.
Okay. Yeah, I was recently in New York and visiting and met with someone who lives in New York, and they had the app on their phone. So I just was curious if you'd heard anything about Delaware doing anything like that.
Yep, I haven't heard here locally.
Great. Right.
Okay, do we have any other questions?
Okay.
All right, should we look for another date then?
Yeah, let's look for another date. We'll look towards the 1st of November. Would that work for you? Do it in about a month, since we're looking at Christmas?
Sure.
Let's see, today is, you want to try, does Tuesday the 2nd work for you at 9?
Yes.
Does that work on our calendar? Anybody? Okay.
And what day we,
Tuesday the 2nd of November.
November 2nd?
Yes.
So, we can't, we're getting a muffled sound, whoever was talking. I think, was that you, Anne Marie? You're not coming through. So you want to put it in the chat, because we are not coming, you're coming through very garbled.
Mayor?
Yes.
Mayor, it is. Can you hear me now?
Yes, great.
We have,
You're gone again, Anne Marie. There we go.
And something in the chat
Board
message.
adjustments meeting at 10 a.m.
We have a Board of Adjustment meeting at 10. Well, I don't think we'll be more than an hour, so if we did it at 9, we should certainly be able to be out of here. It's only 9:20 now. Is that okay with you?
And I have a 9:30 meeting, but right now, it's already 9:30 right now, so I don't mind.
Okay.
Whatever works for you all, but I can be there from 9 to 9:30 and provide any updates I would need to in that first half hour, if that works for everyone.
That'll work.
That'd be perfect.
Okay, so let's plan on the 9th. Oh, the 2nd. Oh, the 2nd at 9 a.m.
Okay.
Okay.
All right, thank you, everyone.
Thank you very much.
Thanks.
Stay safe. Get your vaccine if you don't have it.
Ready?
Okay. Thanks a lot, Paul.